Welcome everyone, welcome back to Health Talks hosted by the Great Physician Ministries. We're happy to bring you another esteemed speaker today, Dr. Mhlana. She hails from Tygerberg Hospital. She's a specialist physician. She'll be talking to us today about diabetes mellitus, definition, complications, how to diagnose it. Welcome, Dr. Mhlana.
Hi, Luyanda.
How are you today?
Thank you for having me. I'm well, thanks. How are you?
Great. I'm happy to have you here. So just take us slowly, Doc. We want information and want to be taught. What is diabetes mellitus?
So diabetes is basically when the blood glucose is too high.
Okay.
So there are two types of diabetes.
Yeah.
There's type 1 and type 2. Type 1 is often diagnosed in children, and type 2 is the most common one in the adult population.
Sure.
So the problem with diabetes is that you have, like I said, you have very high glucose level in the blood. And the problem with that, the underlying problem is that you either do not have a hormone called insulin.
Okay.
So this hormone is produced by an organ which is called the pancreas. So this insulin is very important because we need it for glucose to get into cells. So our cells need glucose because they use it as a form of energy. So they need it in order to grow and do other metabolic functions.
Yeah.
Okay. So I'm going to speak more about type 2 diabetes, but I'm going to speak briefly about type 1 as well.
Okay.
So type 1, the problem is that the primary problem is that the pancreas is not producing insulin at all.
Okay.
So that is why it was previously called an insulin dependent.
Sure.
Because they need insulin in order to survive.
Okay.
So with type 2 diabetes, the problem is that the pancreas is producing insulin, but it's not producing enough, as well as your body cells are not responding to the insulin.
Okay.
What we call insulin resistance.
Yeah.
Okay.
Okay. Thank you, Doc. Thank you so much. So basically, there are two types: it's type 1 and type 2.
Yes.
And you're saying type 2 is mainly because of things like obesity.
Yeah.
Whereby you do have the right ingredient, but it's not working because of resistance.
Yeah.
Okay, great. So, and what are some of the risk factors to development of? Obviously, you've told us the genetic component to it, or genetic predisposition. But what are some of the risk factors?
Okay, so genetic predisposition. So if your close relative, if your mom or your dad have diabetes, you are likely to develop diabetes. Okay. But the biggest risk factor is being overweight and obesity. And the obesity, basically the fat in the abdominal area, the chest and abdominal area, that's the dangerous one that leads to insulin resistance. Okay, so it's that. Apart from that, you have like increasing age as well. As we grow older, you're likely to develop diabetes. And also, especially in women, polycystic ovary syndrome is also a risk factor for diabetes. And diabetes, because it's a disease of lifestyle, is very much associated with other diseases of lifestyle.
Absolutely.
So such as hypertension and high levels of cholesterol in the blood.
Okay. In fact, one of the reasons why we are talking about diabetes today is because if you look at the statistics of South Africa, mortality, it's number 2 cause of death.
Definitely.
So it's a big thing. And people are talking about COVID-19, rightfully so. They have to talk about COVID, but there are things we seem to forget. TB is still here with us. There's still diabetes, and there's still hypertension. So that is why we are talking about this today. And then one person may ask, how will I know that I'm probably having diabetes? Meaning, what are the symptoms, or how do I present?
Okay. So the common symptoms of diabetes are the symptoms that indicate that you have very high level of blood sugar.
Okay.
So that would be frequent urination, especially at night, being thirsty, excessive hunger as well, and just feeling tired as well. And some people have weight loss, unintentional weight loss. Okay. Yeah. So those are the most common symptoms, but some people, especially with type 2 diabetes, they may present with complications already, which I'll speak about at a later stage.
Okay. So it sounds to me that if you are eating a lot, you are passing a lot of urine, you are drinking a lot, you must be concerned. So you must go to your doctor.
Especially if you are somebody that is likely to develop diabetes with a family history.
Yeah.
Okay, so you must be really concerned.
I think that is enlightening. So one can obviously go to a day hospital, go to a GP, or even go to a hospital and just ask to be checked for diabetes. And I know obviously they will get their bloods checked. And when do you say diagnosis of diabetes mellitus is made? Meaning, how do we diagnose it?
So that will be somebody with symptoms, like we've mentioned.
Okay,
so if they present with those symptoms and they get to the primary health center and they get their blood sugar checked, so there are values or cut-off values that we use. So if you have symptoms and your blood sugar is more than 11, so that is a random blood sugar.
Okay.
So that is indicative of diabetes, right? Sometimes we do other strategies whereby we make somebody fast, so meaning there's no calorie or food intake for at least 8 hours.
Okay.
Then when we check the blood sugar and it's more than 7, so that is indicative of diabetes. And sometimes we do a blood test which gets sent to the lab. We call HbA1c, and that tells us the level of blood sugar in the blood for the past 3 months, and we call that HbA1c. And if it's more than 6.5%, then it's a diagnosis of diabetes.
Okay, thanks, Doc. Well, I mean, most of us will forget those values the next 10 minutes. So I think the most important thing, or the take-home message, is that if you have the symptoms Dr. Mhlana spoke to us about, peeing a lot, eating a lot, being thirsty all the time, you probably should go get checked, and then the professional should look at your diabetes and your sugar levels and either make a diagnosis or not. And just to go back to what you said earlier, that some of these patients already come in with complications, and I mean that is concerning. What are some of the complications you see in your practice? So
the problem with diabetes is that you have very high levels of blood sugar for a very long time. So that tends to damage the lining of the blood vessels. So the blood vessels we're talking about are the bigger blood vessels as well as the smaller blood vessels. So the bigger blood vessels are the blood vessels that lead to the brain, to the heart, and to the legs. So they will present with a stroke, for example. They'll present with heart attack, and they'll present with pain in the legs on walking, what we call intermittent claudication. And the other complications will be something like a retinopathy, whereby they present with eye problems, blurry vision, or even blindness. And they can present with kidney problems. Diabetes is one of the commonest causes of chronic kidney disease in South Africa and in the world generally. So chronic kidney disease, they can present also with what we call peripheral neuropathy due to the damage to the nerves. So how that present is that they may have numbness or loss of sensation on the legs, or pain, burning pain on the legs, or in the feet as well. And another feature of neuropathy, especially in males, is erectile dysfunction. And sometimes you may feel that when you stand up, you feel dizzy because your blood pressure drops when you stand up due to autonomic neuropathy.
Thank you, Doc. Well, I think for me and for most men out there, erectile dysfunction, we don't want that. So I think we should go out and get checked for diabetes mellitus. We've learned today that you can. I mean, obviously, it already 3 main organs. She mentioned the brain, the heart, and the kidneys. So already we're at stake of dying from diabetes. So the sooner we get checked, the better. That's what I'm learning from Dr. Mhlana.
And the most importantly, diabetic people often get amputated, and that's because they don't have the sensation on the feet. So they may have ulcers. You may step on something and you're not aware because you're not feeling the pain, and it just spreads, the infection spreads, and then you end up getting amputated. So it's important to look at your feet, or if you can't, ask somebody to look at your feet just to make sure that there are no wounds there.
I think that's very important. So just feet examination. Check your feet if there are no ulcers or anything. Thank you, Dr. Mhlana. I think you have shed some light today. We now know what diabetes is, how to, what the risk factors are, how it presents, complications. And I think now, obviously, we have to understand that if one is definitely diabetic, is diagnosed with diabetes, and has accepted the diagnosis, how then do we treat how do we treat diabetes?
Okay, so we put a lot of emphasis on lifestyle changes because it's very much a disease of lifestyle. So what that means is your dietary modification,
I like that,
physical activity, dietary modification. It doesn't have to be expensive, you can just modify what you have, less sugary stuff, less junk food, for example, buying brown rice instead of white rice, sweet potatoes instead of the white potatoes, smoking cessation. Smoking also causes damage to the blood vessels. So if you smoke and you have diabetes, it's a bad combination. So stopping smoking, it's very important. Physical exercise as well, and we don't mean like fancy gym equipment or gym membership, just brisk walking for at least 30 minutes, at least 3 times a week. It should be sufficient. But apart from lifestyle changes, we do also give medication for diabetes. And it's a stepwise approach. So we start with oral tablets. So the tablets that we use are essentially to assist the pancreas to produce insulin or to help the cells to be more sensitive to the insulin. But if your diabetes is still not well controlled on oral tablets only, then we add insulin.
Thank you so much.
But the most important thing is to check your blood sugar at least twice a day, just to make sure that it's within the acceptable
range. Thanks a lot. I think the key thing I'm learning from this discussion with Dr. Mhlana is lifestyle. I think we have come to realize that a lot of our mortality is driven by lifestyle choices, which is why then we have to talk about this. Hypertension, lifestyle, lung cancers, they are related to lifestyle to some extent. Now we are learning diabetes as well, lifestyle. So lifestyle. And Dr. Mhlana is saying we don't have to be gymnasts and run 1,000 kilometers. Just walk, 5 kilometers a day. And what I've learned is that consistency is better than intensity. So just be consistent. Do whatever you're doing consistently, and you will reap better results from that. So thank you, Dr. Mhlana, for enlightening us again today about diabetes. Now we know what diabetes is, what complications are, and what to expect from diabetes. Your parting words to our listeners?
So, just once more, diabetes, it is very much a disease of lifestyle. So, it's important to be cautious of what we eat. Physical exercise is very important as well. If you're diagnosed with diabetes, it's important to take your medication. And because diabetes is usually associated with hypertension and high cholesterol, so it's very important to take medication for those conditions as well, just to make sure that we prevent complications.
Yes, absolutely. Thank you, Dr. Mhlana. Compliance. Yeah. So it's one thing to have the diagnosis, the disease, but it's another to take your medication. So she's saying if you are diagnosed with diabetes or hypertension or anything else, it is very important to take your medication. Thank you so much, Dr. Mhlana.
Thank you, Luyanda.
Yeah, and to everyone who's watching this, we will do another talk soon, and we'll have another guest to talk about, just simple things, simple conditions, and just to help us to try to be better people. And remember, lifestyle conditions, we can do, something about them, and it depends on us. Till next time, cheers.
Thank you.